Hi, Dr. John LoMonaco here from Houston, Texas, talking to you today about how to speed your recovery. I get a lot of questions from patients that are asking, how do I make my recovery faster? How can I have a better or quicker recovery? How can I get my energy level back to normal sooner? And how can I have the best results? What can I do prior to surgery? So let's talk about that. I want to talk about three main areas. One is going to be your nutrition. I'm going to break that down into protein nutrition and vitamin supplements. A third major area is activity. And what activity level can you do that actually helps your recovery after surgery? So we'll talk about those three things, which I think are the main players in getting you to heal as quickly and as well as you can after plastic surgery. First, a little bit about the plastic surgery healing process. So plastic surgery is a huge healing burden on your body. You've all seen the incisions. They're very long incisions. But remember, when we're doing a body lift or a tummy tuck, it's not just the scar that heals end to end. Remember that all the tissue has usually been separated from the body wall and pulled down or made tighter. All of that area has to re-adhere, and the skin and fat has to re-stick or heal to the body wall. That takes a lot of energy, it takes a lot of protein, it takes a lot of healing. So your body is going to experience maybe one of the largest healing burdens it has ever had in your life. These extensive plastic surgeries, especially the body lift combined with other procedures, is a big healing burden. So it's very important to be sure that your nutritional intake is as good as it can be. So let's talk first about vitamin supplementation. So vitamin deficiency and mineral deficiency is very common after weight loss surgery. Should a normal person who has not had weight loss surgery take vitamins? There's a lot of literature that debates that. Maybe these multivitamin supplements, these mega doses of vitamins, don't make any difference at all. That's maybe what I believe. However, if you have had bariatric surgery, duodenal switch, sleeve, Roux-en-Y, band, any of the other older surgeries, which are not very common these days, you are probably going to have an iron deficiency. That is by far the most common deficiency I see. I see some very profoundly low iron levels in my patients who are unaware that they had them. They're usually not checking their levels and they're usually not taking their supplements. That is one thing before plastic surgery that you really want to get fixed up. Have to have your iron level checked if you're not taking routine supplements. Have to have your blood count checked, and have to have what's really called an iron panel or iron studies. It's 4 different studies that tell us not only how much iron you have stored, what your current iron level is, and then what your blood count is. Sometimes one of those things will be very abnormal, and the rest of them are okay. It takes a long time to correct iron deficiency, so that's something that I want to find out about when I first meet the patient. I want to see whether or not I need to check their blood levels. If they haven't been taking supplements, if they're not following up with their levels, and it's been a while since they had bariatric surgery, I'll put money that they're going to be iron deficient. So that's one very important mineral deficiency that patients can have. Others are going to be more specific as to the type of surgery that you have had. If you've had a duodenal switch, it's going to be vitamin K and calcium primarily. If you've had a bypass or a sleeve, there's other deficiencies. I'm going to let you rely on the advice from your bariatric surgeon on what to do. You should follow that advice, and you should probably get your vitamin levels checked at least once a year, and certainly prior to planning a big plastic surgery. The last thing anybody wants is a cancellation, and that's something that I see here on the boards and I read about of these undetected vitamin deficiencies or anemias. So that's something that I believe a plastic surgeon should address and patients should address in the planning phase of plastic surgery, not the week before surgery. So the next thing I'd like to talk about is protein deficiency and supplementation. A lot of conflicting information out there about that, and I'll be general, but that's something that I think is very important in getting you to heal as best you can. First, I want to talk about a couple of the different dietary modes that patients who are losing a lot of weight or have lost a lot of weight will put themselves on. The first is going to be eating for weight loss. And you all who've lost weight know that that's going to involve fairly strict calorie portion control, counting your calories, counting your different types of macronutrients, fats, carbs, and sugars. Everybody has a pattern that they're going to follow that works for them or that their surgery allows them to do that they're going to eat for that weight loss, okay? Then there's eating for maintenance, and that is going to be sometimes a little different. That is when the diet and the exercise level are going to balance each other out. And those two things are intimately related. The more exercise you do, the more liberal you can be on your diet. The less exercise you do, the more you're going to have to bring your dietary intake down if you want to maintain your weight loss. So eating for maintenance is another mode of dietary intake that patients strike a balance with. What patients often don't think about, though, is eating for recovery. Your body's completely changing after these huge plastic surgeries. There's a huge healing burden, a huge healing or nutritional deficit that you have to make up. Patients often resist this. They don't like the idea. What do you mean, Dr. LoMonaco? You're telling me to put some ice cream in my shake? Carbs are what got me in trouble in the first place, or I can't eat that fat. I'm going to get fat again. So while I understand that, it's very important that you not only have protein, but you also have to have carbohydrates to put that protein to work. So increased caloric intake is a part of eating for recovery, and that is important for at least the first month after surgery if you want to heal properly. And I see patients who will stick to their very strict diet. They'll have pain medications, or they'll have discomfort after surgery, and they won't eat, and they think they're doing great, and their incisions are falling apart. So we want to avoid that. So let's talk a little bit about protein and macronutrient balance. So protein is a very important macronutrient that we take along with fat and carbohydrates that fuel our body. Protein are the building blocks. That's the brick and mortar and wood that you're using to build a building. And fats and carbohydrates are the energy source. That's the Coke and bologna sandwiches you got to feed the workers to build the stuff. If you eat all protein and don't consume an energy source, you are going to force the liver to convert that protein into sugar in a process called gluconeogenesis. It's very inefficient. It's bad for your kidneys. It's not a good thing. So that's something that we want to avoid. So what do I generally tell patients? How much protein should you eat? Well, our rough guideline is around 0.8 grams per pound. So that means if you weigh 150 pounds, maybe 90 grams to 110 grams of protein a day. That's kind of a lot, and I try to get away from that blanket guideline, but that is one number that you could look at in terms of just under a gram of protein per pound of body weight is what you should be eating after surgery. But I really like to look at things in a more balanced perspective, in a little bit more holistic way, which is what percentage of my calories should be protein. And in general, in patients who are eating for recovery after a large plastic surgery, I'm going to recommend that about half of your calories go in as carbohydrates, 25% or so is fat, and 25% or so is protein. You can play with those last two numbers. You could go all the way up to 35 or even 40% of your calories as protein, and I think that gets patients healed. So it's very important to not just eat a lot of protein. It's very important to take those protein calories in along with carbohydrates. So a lot of patients kind of have their own ideas on this, but that is what I tell my patients I want them to do to get not only protein, but also a source of energy to get them healed up as quickly as possible. So vitamins and protein are a big part of healing, but I'll tell you what I think is even more important to get patients really healed after surgery, and that is aerobic or cardiac conditioning. My 55-year-old spin class queens kick butt on my 25-year-old couch potatoes, okay? Both had the same surgery the same week. I see them 5, 10, 20 days after surgery. Night and day difference between my physically active folks. And by physically active, let me be specific. I mean cardio fitness. If you can get yourself cardio fit prior to surgery, you will dramatically decrease your recovery time and increase your energy level. Why? Surgery is a stress on your body. After surgery, stress hormones are released, your pulse rate goes up, your basal metabolic rate goes up in response to injury and to facilitate healing, and your temperature can even go up. So for all of those reasons, patients who are cardio fit, whose heart can pump, whose blood vessels are used to exercise, do a whole lot better than patients who are deconditioned. So conditioning is great. What can you do to condition yourself? There's a million things. You can do the Stairmaster, the treadmill, the exercycle, stationary bike, water aerobics, boot camp, walking, kickboard, anything to get your pulse rate above normal and watch that pulse rate recover. You can do that on my phone. I can touch a button on my phone and it measures my pulse. Whatever it is that you decide to do, I want you to get that pulse rate up into the 120s or 140s, whatever kind of your maximum pulse rate is when you are really pushing yourself, and measure it, how long it takes you to recover. So recovery of your pulse rate back to normal and reaching that maximum pulse rate is cardio conditioning or aerobic conditioning. That is a fantastic way to really get yourself conditioned for surgery. Weight training, building up muscle mass, not so much. Now, if circuit weight training and doing reps or bands or whatever you want to do to get your pulse up is your thing, you can do that in a way that is aerobic and get your pulse rate up. But simple powerlifting or trying to build muscle mass prior to surgery, not so helpful. So cardio conditioning by doing aerobic exercise really makes patients heal a whole lot better. So I'm very happy to see patients do that, and I recommend it to decrease your recovery. So there's a little bit about recovery and healing after plastic surgery and how you can optimize your results. I'm probably going to do a part 2 to this video, which will include other things that you can do to increase and maximize your recovery and improve your results. And those are going to have more to do with some simple supplies and things that I recommend for my patients to get at home prior to surgery, a few things you can do to facilitate the relationship and communication with your plastic surgeon after surgery, and even some things to do to get your kind of home environment squared away so that your healing is as quick as it can be, your recovery is as short as it can be, and your results are as good as they can be. I always appreciate being able to contribute to the group. Thank you all so much for your questions and comments. Please feel free to ask anything in the comment section below, and I'll get to it as soon as I can. Have a good day.